What is breast cancer? Breast cancer is an uncontrolled growth of breast cells. Normally breast cancer starts from inner lining of milk vessels or from the milk-producing glands that provide the milk to milk vessels. A tumor is formed in these cells. The tumor can be detected by an X-ray. Sometimes you can feel this tumor as a bulge in your breast, though usually breast cancer is found in women, but males are also affected by breast cancer. Breast cancer includes 16% of all female cancers, and there are 18.2% deaths out of all cancer deaths due to breast cancer. Breast cancer are related to malignant cancer. Basically, malignant are those which may be dangerous to health and benign are those which are not dangerous to health. DNA changes are a common cause of breast cancer. Some DNA changes are inherited and are the root causes of many cancers that run in families. One important point is that most DNA changes that are related to breast cancer are due to the lifestyle of women rather than having been inherited. The anatomy of a female breast. There are connective tissues, thousands of milk-producing glands and fat in a matured breast. The milk-producing glands are connected to milk ducts. These ducts carry milk from milk globules towards the nipple, and milk is fed to the baby through nipple. So now we will discuss about symptoms of breast cancer. 1. The very first symptoms of breast cancer is a thick tissue in the woman's breast. You may feel as a lump in your breast, though all lumps are not cancerous, but you should get them checked by a healthcare professional. 2. A swelling or lump in one of the armpits. 3. A swelling of the breast partially or fully. 4. You may feel pain in the armpits or breast, and this pain is not at all linked to the menstrual period. 5. There may be a discharge from one of the nipples. Sometimes discharge may have blood also. 6. There may be a pitting or redness on the skin of breast. 7. The nipple may become sunken or inverted. 8. A rash around, or on, one of the nipples. 9. You may feel the change in the size or the shape of the breast. 10. The nipple skin or breast skin may have started to peel, scale or flake. Now you are thinking how breast cancer spreads. A lymph system may become the medium to spread the breast cancer. The lymph system consists of lymph fluid, lymph nodes and lymph vessels. The lymph system spreads throughout the body. Lymph nodes are basically a collection of immune system cells. They are small in size and bean-like in shape. Lymph nodes are connected by lymph, or lymphatic, vessels. Lymph vessels are similar to small veins. The difference is that instead of carrying blood, they carry a clear fluid away from the breast. The clear fluid is called lymph. Tissue fluid and waste products and immune system cells are contained by this lymph. Breast cancer cells can enter lymph vessels and begin to grow in lymph nodes. If cancer cells have spread to your lymph nodes, there is a higher chance that the cells could have spread to other places in your body. If cancer cells have affected more lymph nodes than breast, there are higher chances of spreading cancer to other organs of body as the lymph vessels of breast drain under the arm, near breastbone and collarbone. The next topic is causes and diagnosis of breast cancer. It is not very sure what causes breast cancer. There are some risk factors that can impact for developing breast cancer. First one is more age. There is a high risk for an older woman to have breast cancer than a younger one. There are 80% cases of female breast cancer to those women who are more than 50 years of age. Second one is genetics. Women who have a family history of breast cancer or a close relative who has had breast cancer are prone to have breast cancer. The majority of breast cancers are not hereditary. There are some genes that may produce higher risk of breast cancer. These genes are BRCA1, BRCA2 and TP53. Third is a history of breast cancer. There are more chances of developing breast cancer to a woman who have had breast cancer history than to a woman who have no history of the disease. Fourth is having had certain types of breast lumps. There may be some benign lumps which are basically non-cancerous but may be the reason for developing breast cancer in later stage. Atypical ductal hyperplasia or lobular carcinoma in situ are the examples for those cases. Fifth is exposure of estrogen. If there is longer exposure of estrogen than usual, there are chances of breast cancer. There may be two cases of having more exposure of estrogen. First one is when a woman started having periods earlier than usual, and the second case when a woman entered menopause later than usual. And 6 one is Obesity. There are higher risk of breast cancer for women who has postmenopausal obesity and are overweight. As per experts, there are higher levels of estrogen in obese menopausal women, which may be the cause of the higher risk. Now the seventh one. Alcohol consumption. The chances of breast cancer increases with increase in the consumption of alcohol. Expert says that a woman should not exceed 1 alcoholic beverage per day. 8.1 is HRT, that stands for hormone replacement therapy. Hormone replacement therapy may increases the chances of developing breast cancer. There are mainly two types of hormone replacement therapy, combined and estrogen only. Combined HRT causes a higher risk. Cosmetic implants may undermine breast cancer survival. In a latest study, it is found that a woman with a cosmetic breast implant has a higher risk of being diagnosed with breast cancer when the disease has already advanced, compared to those with no implants. Now, diagnosing of breast cancer. After detecting certain signs and symptoms, women are usually diagnosed with these tests. 1. Breast examination. The physician checks the patient's breasts, especially for lumps and other possible abnormalities, such as inverted nipples, nipple discharge, or change in breast shape. The patient will be asked to sit, stand with her arms in different positions, such as above her head and by her sides. 2. Mammogram, a kind of X-ray, commonly used for breast cancer screening. If anything unusual is found, the doctor may order a diagnostic mammogram. 3. 2D combined with 3D mammograms. There are 2D and 3D mammograms. When both mammograms are used in collaboration, they provide better results. 4. Breast ultrasound. A lump or abnormality as solid mass or a fluid-filled cyst can be found easily with ultrasound. 5. Biopsy. In biopsy, a sample of tissue from lump is surgically removed and sent to the lab for analysis. If the cells are found to be cancerous, the lab will also determine what type of breast cancer it is. 6. Breast MRA, magnetic resonance imaging, scan. A dye is injected into the patient. This type of scan helps the doctor determine the extent of the cancer. What about the treatment and side effects? The treatments available for breast cancer are: 1. Radiation therapy or radiotherapy. 2. Surgery. 3. Biological therapy or targeted drug therapy. 4. Hormone therapy. And 5. Chemotherapy. So, very first one is surgery. In surgery, the tumor and a small margin of healthy tissue around it is surgically removed. In case of simple mastectomy, the lobules, ducts, fatty tissue, nipple, areola or some skin portion may also be removed. If cancer is severe, the whole breast may also be removed. Chemotherapy. There are chances of recurrence of cancer or spreading of cancer in other parts of the body. If chances are high, oncologist recommends chemotherapy. This is called adjuvant chemotherapy. In case if the size of tumors are large, chemotherapy may be administered before surgery. The purpose is to contract the tumor, so that removal of tumors becomes much easier. This is called neoadjuvant chemotherapy. If the cancer has spread to the other parts of the body, chemotherapy may be administered. The growth of some breast cancers may be because of estrogen. Estrogen production can be controlled by chemotherapy. Side effects of chemotherapy: hair loss, nausea, vomiting, loss of appetite, fatigue, sore mouth, and a slightly higher susceptibility to infections. Next is radiation therapy or radiotherapy. In case of radiation therapy, controlled doses of radiation are targeted at the tumor to destroy the cancer cells. Normally, radiotherapy is used after surgery or chemotherapy to kill off any cancer cells that may still be around. Normally, radiation therapy is applied after 1 month of surgery or chemotherapy. This is a very short time therapy. It takes only some few minutes for one session. Multiple sessions may be required as per the condition of cancer cells. There are different types of radiation therapy, which depends on type of cancer. Sometimes, radiotherapy is not at all required. Now, hormone therapy or hormone blocking therapy. Some breast cancers are sensitive to hormones. Hormone therapy is used for these types of breast cancers. These types of cancer are often referred to as ER-positive, estrogen receptor positive, and PR-positive, progesterone receptor positive, cancers. The aim of hormone therapy is to prevent cancer recurrence. Hormone blocking therapy is usually used after surgery, but may sometimes be used beforehand to shrink the tumor. There may be some cases when surgery, chemotherapy or radiotherapy cannot be applied, then hormone therapy may be the only treatment for patient. One important point is that the cancers which are not sensitive to hormones cannot be cured by hormone therapy. Biological treatment or targeted drugs. 1. Trastuzumab, Herceptin. There is a protein called human epidermal growth factor receptor 2 positive, HER2 positive, which promotes the growth of cancer cells. Herceptin targets this protein, and by doing so it reduces the growth of tumor. There may be some side effects as skin rashes, headaches, and/or heart damage. 2. Lapatinib, Ticurb. Sometimes Herceptin does not suit to some patients. In that case, Ticurb is used targets the HER2 protein. 3. There may be some side effects as painful hands, painful feet, skin rashes, mouth sores, extreme tiredness, diarrhea, vomiting, and nausea. 4. Bevacizumab, Avastin. Tumor get the nutrients and oxygen from blood vessels. If the contact between tumor and blood vessel is terminated, the tumor will not get nutrient and oxygen. It will cause tumor to starve. 5. There may be some side effects, as congestive heart failure, hypertension, high blood pressure, kidney damage, heart damage, blood clots, headaches, mouth sores. Now we will discuss about the prevention of breast cancer. Prevention is always better than cure. Here we are going to discuss some lifestyle changes that can help significantly to reduce the risk of developing a breast cancer. 1. Alcohol. It is found that the women who drink less, or do not drink alcohol at all, have less chances of breast cancer, compared to those who drink large amounts regularly. So put a caution on alcohol consumption. 2. Don't smoke. Researchers have found link between smoking and breast cancer risk, particularly in premenopausal women. So avoid smoking. 3. Physical exercise. There is less chances of breast cancer for women who exercise regularly. 4. Diet. Healthy diet is the key to avoid several diseases. Marine and 3 polyunsaturated fatty acids have been found effective to avoid breast cancer. Marine and 3 polyunsaturated fatty acids are derived from marine sources. 5. Body weight. Women who have a controlled body weight have less chances of breast cancer compared to overweight females. 6. Breastfeeding. Women who breastfeed run a lower risk of developing breast cancer compared to other women. If you like this video, please like and share this to your friends, to enhance the knowledge about breast cancer. If you have any question, please write down in comment box. You may subscribe this channel for more upcoming health related videos.